All right, today we're going to be talking about ultrasound. Up here on the table I got my 53-year-old, I have Ronnie. He's a 53-year-old male who sprained his ankle after stepping in a gopher hole 2 days ago. So he's in an acute phase of healing right now, which is one of the indications for ultrasound. So there are a couple of contra indications as well, like over and impaired areas of impaired pain or temperature sensation, or impaired sensation in general, impaired circulation. You obviously wouldn't want to put it over reproductive organs, and it says that you want to avoid putting it over the epiphyseal areas in children, along with other things like malignancies, and you don't want to put it over. You want to think twice about doing it with women who are pregnant. So in this case, it's a superficial wound. So let's go ahead and talk to our patient and we'll go from there. Hi, Ronnie. How are you?
I'm great, thanks.
How's your foot?
It's in a lot of pain, just swollen.
Do you mind if I check it out?
Go for it.
Is it all right if I place my hands on your foot? Could I actually have you remove your sock?
Of course.
Have you ever had ultrasound before?
I have not. I don't even know what ultrasound is.
Does that hurt?
Nope.
So this machine right here is ultrasound. It has this wand that I'm going to be using. It'll help to kind of help the tissues to heal. There's a like microphysiological processes that happen that'll kind of help with the healing process. So.
Okay.
In order to get started, because this is a superficial wound, we would set up the ultrasound. So you press sound, and then it's asking for how many megahertz. So if it's more superficial, you don't want to use 1 because that's for deeper, and then 2 is a little bit less, and then 3 is the most superficial. So you click it on to 3, and then for the duty cycle, because we don't want this to heat up too much because she's in the inflammatory phase of her healing. We want it to be a non-thermal ultrasound, so we are going to put it on the 10% duty cycle. That'll mean it'll just be on for 10% of the time. For power intensity, these normally range from 0 to 2 watts. We're going to leave it on 0.5 so that it's not going to be too intense for her. And we're going to go ahead and set a timer for 8 minutes. You don't want to press start until you have the gel on the wand on the area that you're going to be treating, and only then do you press start afterwards, because there's a crystal in here that vibrates and radiates sound waves, and it can actually damage the crystals. So unless you have a medium for it to go through, you can apply this directly onto the patient or onto the head of the wand, either way, as long as you have an ample amount. Oh, nice, okay. And I'm just going to put that on there. And now that it's on there, I'm going to go ahead and press start. And you want to go in a small circular pattern. On this patient, the wound is around the lateral malleolus of the ankle, and they have what's called the ERA, the effective radiating area, which is really small, and so you wouldn't want to use ultrasound on a really big area because it becomes less effective. There's really only a small area of this wand that actually radiates any sound waves. So how does that feel, Ronnie?
It's feeling pretty good. I mean, just a little bit of sensation, but nothing painful or anything like that.
Okay, yeah, that's typical. So that's probably what we're looking for. And so now that I'm just going to pretend like 8 minutes has gone by, and what I want to do is press stop, but I don't want to stop moving the wand, especially if this were a thermal ultrasound. you could really burn somebody if you stop moving the wand. So you want to be careful to keep moving the wand and then press stop. But we're going to pretend like the 8 minutes has gone by. All right. So how does that feel,
It's
Ronnie?
going pretty good.
All right, perfect. That's what we like to hear. Let me just go ahead and take a look at this. So I'm just checking to see if there's any damage or anything like that. It looks like everything's good. Does that feel all right to you?
Mm-hmm. Feels good.
All right, we're good to go.
I'm healed.